I want to start quickly, and I'll try not to take a lot of time, but all of us in this room have been through happy occasions. We've celebrated weddings. We've celebrated birthdays. We've celebrated graduations. We've been to the beach and grilled and shared food and all of those fun times together. But unfortunately, I bet everyone sitting in this room has also gone through very difficult, sad things, adverse experiences in your life, some many more than others. And I want to take you back. You think of a time in your life, maybe your family experienced a suicide of a family member. Maybe your family is dealing with an addiction of some kind. Maybe your family has a divorce. Maybe your family has experienced all kind of things that I don't know, because maybe I haven't experienced what you've experienced in your lifetime or your family. I want you to think about that time. Think about when you were going through that part of your life, if you were a child possibly and these things happened to you, or as an adult. How do you handle that? Are you productive at work? Are you productive in the environment that you're supposed to function in when all around you is swirling and things are so difficult and so hard? I'll have to confess, when I was asked to facilitate this committee, I went, safety and well-being? I'm a teacher. I know a lot about student learning. I can go over there and tell them what to do to amplify student learning. I'm an educator. Educator preparation, I know what we should tell those teachers. I know exactly how to go to that committee and tell them what to do. Modernization, oh my gosh, just put all that thing on the screen up there and let them have their devices and just let them go to town. There's so much out there. But I cannot tell you, this is the heart. This is the heart of what we have got to get right for our kids at school. And I'll get very emotional, even though I wasn't on the Amplify Student Learning and those other committees. This is the best committee. Because it truly is the heart of what happens to those children when they walk into that school every day. And I'm going to stop because they're going to show you that. And the passion that they approached this with is unbelievable. And I'll wait till the end, and as we go around and pass the mic, I'll let them introduce themselves. But we ended up with 3 goals, and I have 3 presenters, and Mary McMahon is going to be our first.
Thank you. First, I'd like to say that I'm just so incredibly impressed with everyone in this room. What the work that we've done is life-changing work. It's transformational, life-changing work. And so I'd like to start by saying I'm a principal of Colony Middle School. I also serve as the president of Alaska Association of Secondary School Principals. I also serve as the president of the Alaska Council of School Administrators. And my passion is kids. And one of the things that I'd like to invite you all to do is, if you can ever make it to Colony Middle School to see a school climate that's transformative and amazing, anytime, come and see it, because everything we do from the moment kids arrive is transformational. It's intentional, because we don't know where they're coming from, but as soon as they enter our doors, they're received with love and kindness. I get kind of emotional about this because we've had some experiences along the way that have created us, have kind of put this at the heart of why we've created this climate. And so I want to start with the Safety and Wellbeing Committee came up with 3 goals. And each of the goals that we came up with on their own will improve schools greatly. But all 3 of them need to be worked on to transform our schools for every student in Alaska. The Inspire Tribal and Community Ownership group that went right before us, wow. The story that you told about your family and saying, why would I be scared? No one would have noticed me. We have to create schools where every student in our school is noticed, known, and cared for. Every child has a gift, a redeeming quality, and it's our job as educators to find it, nurture it, and grow it. Is Alaska prepared to put children at the center? Your question from your committee, and build a system that lifts up all of our students? I say yes, we are ready to do that. The first goal that we have for our committee is transforming school climate. I was chaired to do this work because it is on my heart to do this every day. I don't like to miss a day of work because it's so important to work on that school climate and to create that environment that students who come to our schools see a family that's healthy and they get to be with us for 8 hours a day in a loving environment. So before we get started, one of the things that I do as a principal, and I'm gonna have you guys do really quickly, I talked to Todd about this, we're the last group to go, but we're gonna end powerful with you guys, is we do two things with kids. We look them in the eyes and we ask them who they are and tell me one thing you're passionate about, one thing that you love, one thing that makes you happy that you think about every day. And so I'm gonna ask you to look to the person next to you before we share our work and share very quickly, 15 seconds each, look into the eyes of the person nearest you and tell them who you are and one thing that you love, one thing that you're passionate about, because we have to build relational capacity with each other as adults, as educators, and with our students in our school. Nobody goes unnoticed in our schools. That has to be the outcome. So quickly just turn next to the person next to you and say who you are, look them in the eyes, one thing you love or passionate about.
I love my wife and my bulldogs. It would be very fun. It's very Stranger Things is actually
Okay, make sure the other person has a chance to share their passion. And then look this way when you're done. I hope that everyone had a chance to look someone in the eyes just now, because so often we're looking at our technology and we forget to look up and into the person's eyes. I saw someone over here at the other side of the room. Tell me your name again. I'm so bad with names, but I know what your passion is. David, continued learning. Yes. I saw him sitting over there alone, and I had to run to him. We have to notice people, and we have to go to them when they're alone and connect. So our first goal is that every Alaska school must work to create a sustainable and positive school climate that is safe, supportive, and engaging for all students, families, staff, and communities. And so the first part of our rationale, is someone clicking the button for us? Awesome, yay, thank you. Is for school climate is, I'm just gonna read it to you because this part is really important and I don't like to read slides, but it's very purposeful. The climate of a school is the visceral, almost palpable sense of safety and belonging that people experience on site. It can be described as warm or cool, safe or unsafe. Research shows that a positive school climate directly impacts indicators of school success, such as increased teacher retention, lower dropout rates, decreased incidences of violence, and higher student achievement. A positive school climate promotes student learning and healthy development. To transform our schools in Alaska and achieve breakthrough results, we must place school climate as one of our highest priorities. Under the rationale for school connectedness and understanding of school expectations, we shared a couple studies. I'm just going to pull out the highlights. This study done in Anchorage, for Anchorage for United Youth in 2012, found that more protective factors youth report in their life, the greater their likelihood of decreased risk factors and increased positive behaviors. The 2015 AYRBS data shows, to sum that one up, this portion of the study we are sharing from the 2015, it shows 1/3 of our students aren't feeling connected. 1/3 of our students are not feeling connected. The next slide on the rationale for bullying. Bullying of students both on and off school grounds is a growing concern. The statistics have gone up, not down. And so we've looked at the 2015 Youth Risk Behavior Survey that shows that students reported not going to school on 8.8% of students on at least one day in the last 30 days because they felt unsafe at school or on their way to and from school. And this percentage is increasing. Suspensions for bully behaviors is increasing. And the data reflects only the most severe incidents. But between 1,421 students were suspended for bullying and harassment. Data from 2007 that is increasing in our schools. According to the 2015 AYRBS survey, 22.8% of high school students at a traditional high school here in Alaska were bullied on school property. And that statistic is growing, and it's higher in middle schools. And that's relatively close to the national average. Go to the absenteeism one. Thank you. We are the second highest in the nation for absenteeism. Almost twice as high as the national average, the state of Alaska. 250,000 days of unexcused absences is what we are seeing in our Alaska Department of Education data, shows that our kids are missing a lot of school. And our kids that need us the most, 15,000 students, are chronically absent. Those are the kids that need to be closest to us, that need us the most, and they are absent the most from school. So that's our compelling data that shows that this is a high priority.
And my name is Pete Hefner. I'm with the Cordova School District as well as the president this year for the Alaska Association of School Boards. And I'll be talking on Goal 2, building trauma-engaged schools. And I believe Keith has brought up several times, mentioned BHAG, big, hairy, audacious goals. And I'll go ahead and read this one. Alaska's schools will create a culturally humble, responsive, and safe environment that recognizes the needs of the whole child, institutes trauma-informed practices, and understands the vital importance of building all relationships surrounding every child to improve resiliency, health, and academic outcomes. The important words there being whole child and improve resiliency, health, and academic outcomes. We were working with the culturally responsive and added the word humble. There are a lot of cultural difference among all of our students, and we're recognizing this, recognizing all the experiences that children bring to schools, their stressful life experiences. Every community is unique. One of the things that was mentioned is that fascinating is actually the Anchorage School District is one of the most, or is the most diverse school district in the United States. We also wanted to recognize that every child has a gift, and it is our role to find it, to nurture it, and to grow it. Culture and family are important in addressing and supporting our children. Underneath the first rationale there, We talk about adverse childhood experiences, and just to mention ACEs. ACEs has been one of the largest breakthroughs in the education process, and what ACEs mean. It deals specifically with physical, sexual, emotional abuse, physical and emotional neglect, intimate partner violence, mother treated violence violently, substance misuse, household mental illness, parental separation, divorce, or abandonment, and in incarcerated household members. And if you notice there, half the children in school have some trauma in their lives. The impact to students' behavior and their ability to learn. We really need to understand this trauma, and we need to have changes to the current school practices and policies. Childhood trauma and living with chronic stress changes the structure of the brain and therefore the function of the brain. Moving on to rationale, the second rationale. This is a pretty shocking slide. You'll notice on there that if you have 4 ACEs, 2.5 times less likely to graduate from high school. With 4 ACEs, you're half as likely to graduate from college. These are pretty astounding numbers. And the final rationale we have there, and this is talking about restorative practices. This is an important one. There's a lot of information out there. I know the movie Paper Tigers, if anyone has seen that, has brought about restorative practices. Marcus Wilson, as a principal at North Star here in the Anchorage School District, has been doing some wonderful work around that. Trauma-informed practices, the discussion is already starting. We have Thread holding a conference here shortly. AASB is talking about trauma-informed practices at the November annual conference, bringing up the concept of whole child and empowering the whole child. The Department of Ed has e-learning modules already developed. One course, Overcoming ACEs in Alaskan Schools, Childhood Trauma, Its Impacts on Learning. That one is out already. Developing 2 more, Traumative Sensitive Schools, and the third is how to go from a trauma-informed school to a trauma-practicing school. Trauma-sensitive schools help all students feel safe to learn. Trauma-informed schools undertake a paradigm shift to recognize and understand and address the learning needs of children impacted by trauma. This requires a commitment to shaping school culture, practices, and policies to be sensitive to the needs of traumatized learners. This effort positively impacts schools and changes life trajectories of the vulnerable students.
Thank you, Pete. My name is Maureen Hall. I'm a school nurse from Juneau, and I'm also part of the Alaska School Nurse Association and sit on a committee, a statewide advisory committee for school nursing and health. For the most part, students in our larger districts do have access to nursing and counseling services throughout the day. And for our transformative goal around student health is to ensure the physical and mental health needs of all students in all schools are addressed. Students enrolled in public education will have direct access to school nursing and counseling services. For the most part, there have been school nurses for the last 60 years. We were brought on by an early territorial governor for the very reason that you mentioned, tuberculosis sweeping through, wiping out entire villages. So school nurses were brought on early on to address chronic disease or infectious disease. And now we see nursing and counseling addressing suicide, rising mental health needs, and let's see, we'll go to our first rationale. We know that in order to learn, a student must first be healthy and safe. And again, the ACE study this is the most important public health breakthrough of our time. If a student is living with chronic stress, the original study showed that down the road in adulthood, they are much more chronic disease. If you have 4 or 6 more ACEs, Valerie? 4, you're likely to die 20 years earlier than someone that has 0 or 1. So it's very important, to really get this right and address the stress that kids are living under, to prevent ACEs and then to mitigate the effects of the ACEs once they come to school, such as having a school, as Mary describes, which truly is focusing on the climate and the culture, is creating a trauma-informed school. Let's see here. So as your ACE score increases, so does the risk of disease, social, and emotional problems. So the rationale for nurses. The available data links a full-time registered nurse in the building with decreased absenteeism. When the number one reason kids are out absent is due to illness, I think it's very important. I know it's a role I value now in my schools that I've come to understand the critical importance is partnering with the attendance lady. Let me know if a student is missing 3 or more days due to illness, and I will reach out to that parents. Do they have access to health services? Do they have a medical home? Do they have health insurance? So again, working with the families, we were talking about what it is we're passionate about. Leona is passionate about baseball and our families. We were both passionate about our families. And I think my passion as a school nurse is building relationships with families to improve the outcomes for the children. Again, decreased absenteeism, increased student performance, and increased graduation rates are all improved with the school nurse, a full-time school nurse in the building. And I know that's challenging with our far-flung state, but I do think those partnerships with tribes and with clinics in the building with our public health nurses, we can be creative about how we make sure that all students have that direct access. While I'm on school nurses, I will mention that we do have a national board for certification of school nurses, which several of the nurses in our state are nationally certified. And unlike teachers, school nurses come to it from such a variety of different life experiences. You may be an ER nurse and decide to switch to school nursing, or a clinic nurse, or a public health nurse. So anyway, it's a specialized practice being a school nurse, and I think fostering that certification process is going to be an important piece in making sure that the nurses we are hiring have the skills they need to do the job. And the rationale for school counselors, again, it's with our suicide rates that are twice the national average. We're seeing an increase in homelessness, in homeless families, addiction, parents dying of overdose, and it's so critical that students with unmet mental health needs can be a significant obstacle to student academic achievement, career, and social emotional development, and even compromising school safety. I bet you would look back at the childhood of any of these tragedies that we've experienced in our nation, and if you would look back at that childhood, you would see a high level of childhood adversity. And school counselors and nurses we're in a position to recognize that. The kid that's coming to me with the stomach ache and or the chronic headache, and partnering with the school counselor to get that child connected with services and to work with the family. Again, that partnership between nurses and counselors is something that increases the time that the teacher is able to teach. It increases the time that principals in a building are able to be the instructional leaders in the building. And also that incredibly important work of working closely with families. It's said that the teacher knows the student best. Well, I would say the school nurse and the counselor and the attendance person knows the family best. In closing, we are one big state, but we are a small community, and it's very easy for us to join our voices together to come up with solutions. We must come together to prevent childhood trauma in the first place, to mitigate the effects that once the trauma has happened, thereby improving the health and educational outcomes and future life success of our students. Thank you. And with that, okay.
So I'd like to end with our committee time, and then we'll have every person have a chance to talk. But also, Santa and Todd were incredible support and facilitators for us. And the passion that each person had, everyone's heart was in this. And in it, in a significant way that made it work so well. This is one of the most important things that I've been a part of, that I know is not only transformational, but life-changing for our kids. And it just gives me so much joy and inspiration to know that we're doing this work. I want to share with you a student voice to end this, just to bring it back to the kids. So one of the things that we did with our school climate and connectedness results is we focused on peer climate at our school, because peer climate needed improvement. And we needed to enlist an army, not just of educators, but of every student in our school. So every student at the start of this year and last year wrote commitment statements about how they were going to take action to make our school the most kind and respectful school possible. And I wrote, and then we have a hashtag CMS Point Positive so that we can share all the good with the public and change public perception about education and hopefully get more money, right? So there's strategy behind all of it. But this student who's a 7th grader, I write, here's one of the reasons I love my job, as I'm shouting out to everyone. All of our students wrote commitment statements about what they will do to take action to make our school the most kind and respectful school possible. And we read them every morning, at least 2 or more, on morning announcements every morning, all year long. And this one, here's one to make you smile and believe in our next generation of leaders. A 7th grader writes, this school is a place that is special and almost impossible because we are almost entirely bully-free. Although nobody is perfect, we want to be as close to that as possible, and we have almost achieved it. We should be proud because it has taken all of us to create this phenomenon, and it will take all of us to finish it. I am willing to do whatever it takes to finish this masterpiece and to encourage others as well, even if we don't succeed, although I doubt that could ever happen to such awesome people. I want everyone to know that Colony Middle School is the best school in the universe. That's a 7th grader. And that's pretty much how our students feel when we empower them to take action to create the change. So Santa, I know you wanted to come up and talk, so thank you.
No, I just want to get a microphone. So I know every single committee has said they're the best, but look, how can I not say mine was the best? So let's take just a minute and I will ask each committee member just to share who they are and just a thought about our work.
Pete Hefner again here. This was an exceptional group to work with. I guess I was supposed to stand up here. And everybody was truly engaged, and I think we've come up with some transformative changes. I'm exceptionally excited about looking into trauma-informed practices and getting it developed statewide.
I'm Lillian Bannerman. I'm a student at Thunder Mountain High School in Juneau, and I think the safety and well-being of students is the most important thing to start with in a school, because I'm a military student and I've been to 10 schools, so I've seen bullying across the nation, I've seen nursing across the nation, whether it's there or not, because I've been to a school that doesn't have a nurse. And so I've seen all these things across the nation, and it takes a lot of people to come together and change it. So I'm really glad that that's what we're doing, because nurses and mental health are incredibly important to a student and their capability to learn.
My name is Norma Holmgard, and I'm the superintendent for the Cashew School District in Chivac. And I just want to point out that we have known for centuries that our schools are little microcosms of the communities in which they exist. So if our schools have a climate problem, if bullying is out of control, if absenteeism is through the roof, if our kids don't feel safe, probably our communities suffer some of those things. So as we're realizing these goals that we've set here, let's not leave out the community. We need to bring them along.
Well, I'm Kathy Giesel. I'm, of course, a state senator, which is why I was asked to be on this committee. But in real life, I'm a nurse practitioner. And I've spent 12 years working in Alaska's public schools, from Anchorage all the way out to very rural parts of Alaska. Yesterday, I spent the whole day in a seminar on reforming healthcare. So it was kind of fun to be in here today to talk about education, because those are the two big spends by state government. So I've really appreciated all of these values that are being presented today and innovative ideas. I am really thrilled about the tribal compacting with our schools. This is awesome because I think of it in the context of healthcare. Talk about personalized healthcare opportunity here. Alaska Native Medical Center, the Tribal Health Consortium, certainly has clinics in every one of these communities and can give that kind of personalized care. I can travel into those communities, but I'm an outsider. One of the things I loved about working in pediatrics at Alaska Native Medical Center is that they included traditional healers. Alaska's First People have solutions for a lot of health problems that we in modern medicine don't necessarily think about, but those opportunities could be available in a school. Right now, just an innovative idea that's happening in the Anchorage School District. I work for a private company which contracts with the Anchorage School District. I work in one of the middle schools here. There's 2 school-based clinics in middle schools here in Anchorage, and one in a high school that's about to open in a couple weeks. It costs the school and the school district nothing because the clinic bills the patient's insurance, takes care of paying any staff themselves, and it's an innovative idea. Way to get clinicians into the schools. We partner with the school nurses who are already there, but there's also behavioral health clinicians available. And we've seen tremendous impact on school performance for kids that receive those behavioral health services from certified licensed clinicians. They're in school. The kids perform better. The teachers have less discipline problems. And those clinicians can help the teachers understand how to respond to a child that's having a difficult time in the classroom so that everybody really benefits. This has been a great committee, and thanks for the opportunity to serve.
James Fields, I'm the co-chair of the committee from the state board. You guys today have given the state board a big task. So a little overwhelming, but I guess that's what I signed up for, right, Commissioner? Nah. This is a big committee for me. I've got 6 kids and 1 guardian, and we have guardianship over another, so 7 total in our house. Out of those 6, we've adopted 3, and me or my wife drive to Wasilla every week because 3 of the kids that we have in our house need trauma counseling. And that's 140 miles every week, one of us has, and we'll continue to do it till we get something local. I say that because we went local. There's a local clinic, but they are not trauma informed. I mean, they counseled, and we're like, okay, we're not seeing any, there's no difference. I mean, the state's spending money. I mean, they're getting their payments, but so finally, my wife, it wasn't me, my wife's like, I think we need to try something different because this isn't working. All that to say, we need to work and collaborate with the local health clinics to make sure that they've got the right people in place. The districts need to collaborate to see if, like one of your ideas about getting even one, but if I have 3 kids, how many more kids in my district aren't even getting the services that they need? So this is and we talked about combining our priorities into one because it's all school climate, but some of these need to be highlighted so they don't get lost. I mean, the trauma-informed is big enough that you start just dumping into the school climate, it could get lost. And we felt it important enough not to get any of those pieces lost, because student learning won't increase if we don't figure out, you know, and one, the child needs to know why they're acting in the way they're acting. The parents need to know why they're acting the way they're acting. I mean, that was ours. We adopted these kids. We didn't know why they were doing what they were, until we got a counselor that knew. It's like, well, this is why they're, and so then we could help in the house. Until then, we were just reacting to the way we were raised, not the way maybe they were raised or the situation they were in. So this is a big deal. I think it's one that sometime in the short term, I think there could be pockets that could increase, but I think this is definitely on long term. Health and Human Services can be involved. This is a good collaborative priority that we can all rally around. So thank you, Commissioner. This actually wasn't even on the radar, was it? We didn't even have a safety and well-being priority. We had 4. And Sue, of course, like, we need 5. We need either 3 or 5. We need 3.
Good job.
And then the commissioner brought up, I want my kids to be safe. That's how it all happened. So this was like the last one of the 5 priorities, but it definitely is an important one. So thank you, everybody, for being here, and I think I've talked enough.
Well done. Keith Hamilton, again, co-chair, State Board of Education. So I have the privilege of serving Alaska Native young people in a college setting down in Soldotna. And the students that I am privileged to serve are full of ACEs. They have high numbers of adverse childhood experiences. They come from situations that are very, very difficult, and they show up on our campus after being through the K-12 system. And they are not prepared for college rigor and to make it through. But we've resolved some of that through a high developmental course offering and through a lot of counseling. We offer free counseling services on our campus with 5 licensed master level counselors. We're doing everything we can, and we're still feeling like, we're scratching our head. What's it going to take in the K-12 to really help every student in Alaska be able to succeed in higher education, if that's their choice, to move on after high school? And it comes down to a couple of things that I've discovered as being the president for 17 years now. And the first one is absenteeism. Our students have just missed a ton of school before they came to us. We had a student say, but I came to all the classes, why did I fail this college course? Because see, in high school, that's how they passed. And they got moved on was by showing up to the majority of the classes. Until a student is in a classroom, their opportunity for safety, being safe that day, if they're not there in that classroom, it may go way down. Their need for a square meal or two, if they're not in that classroom from rural Alaska, in some cases, the opportunity, again, very difficult for them to show up and be in school the next day. They're starving. What am I going to do? A student doesn't show up to school, they don't get educated. So they're missing out. If they don't show up for school, everything else really kind of takes the back seat. We need to have our students in class to be those 8 hours where they're safe and they're loved and they're cared for, as was shown about what's happening over at Colony. And so I'm really pushing hard for one of our, as you saw up there, Rationale is about absenteeism in our state, number 2 in the nation. I'm not proud of that. And so what are we going to do? I hope that the state board looks at that whole issue of absenteeism and that we pull ahead. And the second thing I'll end my sermon here. The second thing is that a gentleman once said to me, a businessman said, until a sale is made, nothing else really matters. And until a child feels safe, nothing else really matters. Maslow's hierarchy of needs, that child has to feel safe. And they will come running to you when they know that they're safe.
Well, I won't speak again, but I will just mention Wisconsin has recently 6 different state departments have adopted trauma-informed practices. So this isn't just for schools and healthcare. This is for our entire state. Okay.
Leona Star Sauza Ita Fred Beifelt Bauza Ina Audrey Beifelt Bauza Sitsu Madeline Beifelt Gailey Helen Atla Bauza Sitsia Alfred Atla Yith Q Beifelt Gailey Bauza Zati Tanatakaten Lesto. My name is Leona Starr. My parents are Fred and Audrey Byfelt, and my grandparents are the late Hugh and Madeline Byfelt of Hooslia and Alfred and Helen Atla of Hughes, and I am from Hooslia. I am a parent representative, and I chose this committee when I was asked to pick one. It wasn't a hard choice because I'm very passionate about our children throughout Alaska. I'm a mother of 4, and I'm an auntie, and all that good stuff. I'm a former Head Start teacher, and currently I work for Tanana Chiefs Conference for the Systems of Care. I'm a youth lead in Hooslia, which I just started 2 months ago. So when we started talking about trauma and all this, sadly, the reality is that probably 75% of our children, sorry, I'm getting emotional. They come to school and you don't know what happened to them the night before. You don't know if they ate before they go to school. Sometimes, they're all coming from hard backgrounds, and we need to work together to change this in our schools, as well as parents, setting good examples for our children. Sometimes in my house, I have 4 children, like I said, and I come home and there's like 8 kids there, and I'm like, and it's overwhelming, but at the same time, it's a safe place for them, and they know that, and our doors are always open, and it's sad, that's our reality, but that is. So we all need to come together and really, I hope something happens from this, because we need to move together, move forward. And if we don't understand where our children are coming from, they're not going to learn. How do you explain, like I had to explain to my boy why his uncle isn't here. And, he committed suicide the year before he was born, and he keeps saying, who is that? Who is that? And that's like really hard to explain to a little, to a child. And like I said, that's the reality for probably over half of the children in our state. So we need to understand where they're coming from and figure out a way to move forward so they can all learn and get the education that they need, because if we just keep ignoring it, then it's not going to go away. It's not going to get better. All these statistics that you've seen today, they're only going to increase. And we have to just stop and set up, like we said, trauma-informed school. We need counselors. We need more nurses. We need all of that. And it's imperative that we get it so we can move forward for our future. Thank you.
Oh, beautiful. And I'm never at a loss for word when I'm passionate about something. I am from Kodiak, Alaska, born and raised, have worked and taught in Kotzebue. I've taught in Chivak. I have a Chupek and Inupiaq name. I know that in every school in Alaska, we can do this. It doesn't matter how much money we have. It comes down to leadership and care and people coming together. And there are no excuses. This must be done. And in saying that, I commit to sharing my action plan with what I've done at my school that can be replicated with all schools, because it's that important. It's life-changing work that has to happen. So thank you.